All right, here we go. You all should have watched lecture from the last two classes online. If you have any questions, we'll address those now. Any questions from last two lectures? Going once, twice. All right. All right, muscular system. Glute max. So gluteus maximus, one of the two glute muscles that we are covering, one of three glute muscles. Biggest, broadest glute muscle. We are going to highlight it here. So here is your glute. Essentially your largest portion of your butt. So if we look at the origin right here, so we have an origin here. And so that origin is going to be the sacrum and ilium. So we see that broad band of tissue, of that tendinous tissue, inserting onto those spinous processes of the sacrum. We also have some overlap on the ilium. So we have, let's highlight here. So we'll have ilium right here. So ilium and sacrum is going to be our origin. And then we are going to insert onto the gluteal tuberosity. So insert here. We also have an insertion onto the iliotibial tract. Oh, wrong way. But for our purposes, we insert onto the gluteal tuberosity. And then based upon where our glute is, it's positioned posteriorly, so we're going to get a little bit of that extension. And since it's also angled in this, in the diagonal manner right here, we are going to pull it straight back. It's going to have that extension action or mechanism. We're also going to have some abduction, abduction. So we're going to pull this way as well. And because we have kind of a posterior, we have a lateral to posterior angle of that muscle, we can also pull or rotate. And we're going to do some external rotation there as well. That's glute max, our big muscle, really one of the main players for that abduction and abduction, extension, and a little bit of external rotation. You'll see quite common throughout this whole unit is we have a lot of muscles contributing to hip extension, abduction, internal, external rotation. So not just one muscle does these actions. It's a combination of muscles trying to assist us in doing these motions. All right. Next, we have tensor fascia latae, or TFL, is sometimes abbreviated. TFL, so tensor fasciae latae. It's a relatively small muscle that typically at this level we will group in with the iliotibial tract. You can see part of our glute inserting onto our IT band. So we have that glute max right here inserting onto our IT band. And the IT band or iliotibial tract has this broad band of fascia that inserts all the way down onto it's called Gerdy's tubercle. So let's make this just a little bit bigger. So TFL tensor, oh my gosh, TFL tensor fasciae latae. Oh, here. All right. So we're going to have an origin superiorly right at our anterior superior iliac spine, or ASIS. And then we are going to insert this muscle right here, going to insert onto the IT band or iliotibial tract. And I am also going to have insertion onto Gerdy's tubercle. Let me make sure I'm spelling this. It's a tubercle on the tibia, just distal to your epicondyles. And so the action, since we're kind of only in this kind of lateral plane, but we do have a couple of actions for this muscle. First, we are going to have abduction or abduction. We are also going to have a little bit of flexion because you can see just ever so slightly that this insertion is a little bit anterior to the origin, which is a little bit posterior. So we'll have just ever so slightly a little bit of flexion. And since we can see just a little bit, the origin is slightly medial to the more lateral insertion, we will have a little bit of internal rotation. Not a lot, but just a little. All right, big broad band of fascia. Quite common to have patients complaining of some pain along the IT band, particularly if they have seen a recent increase in their activity level. Not uncommon to have pain. Not common to have pain along here, to have to kind of massage out maybe some bumps and bruises or adhesions along this iliotibial tract. But essentially from this area is all tendinous structure. So there's not going to be a lot of stretching that you can do for it. There's slight muscle, small muscle here, and then we have our glute that's inserting onto that IT tract, iliotibial tract or IT band right there. More so going to be a whole kind of lower extremity kinetic chain problem that would let's solicit a problem or pain. There it is, from patients. All right. Any questions on TFL? All right. Last two. We're getting into the quad muscles now. Quad muscles, the quadriceps, named for the number of muscles that you have that make up the quad. I learned yesterday that we found a new quadriceps muscle. It's quite small and is a little bit more proximal, attaching on the ASIS and just going. It's like a complementary muscle to the vastus intermedius, but that's something we're not going to cover. So vastus intermedius, 3 of the 4 quad muscles have this vastus name, and they're named for their location. So we have vastus intermedius, so in the middle, medialis and lateralis. So one on the medial side, one on the lateral side, and one in between. Vastus intermedius is the deepest of the 4 quad muscles that you are responsible for. Has a origin on the femoral shaft. So it does not cross the hip joint, unlike some of the other muscles. But it does cross the knee joint, inserts onto the patella and thus the tibial tuberosity. Let me take a step back. So all of your quad muscles insert onto that sesamoid bone that is your patella. For our purposes, all of them will insert onto your tibial tuberosity via your patellar tendon. So your patellar tendon is the tendon between your patella and your tibial tuberosity. But we are just going to specify that they insert onto the tibial tuberosity. And if you really break it down into graduate anatomy, you're inserting onto the quadriceps tendon, and then the patellar tendon is something kind of completely separate, but that's a level of specificity that we're not going to cover. But if you wanted to know, now you do. Insert tibial tuberosity. So that vastus intermedius here, let's highlight this one right here. Vastus intermedius. Right there. And when we get into ultrasound, we should be able to see the different layers of attachment, because the vastus intermedius is the deepest layer of attachment onto the patella, and then you have the vastus medialis and lateralis kind of merge into one layer, and then the rectus femoris that sits on top is a third layer. So when we look at that on ultrasound, we should be able to see the different layers of the quad tendon. So inserts on tibial tuberosity, and then since we're in the front, and we're going to be pulling our tibia towards our femur, that is going to be knee extension. All of the quad muscles do knee extension, and excuse me. All of the quad muscles do knee extension because there's only one that crosses the hip joint. There will only be one that does both hip flexion and knee extension. And we will cover that in the next lecture. But just kind of keep in mind, we're crossing that knee joint, so we are doing knee extension. Quad. All right. And then last muscle that we're going to cover today, vastus medialis. Vastus medialis, let's highlight it right here. So we're going to be more medial with this one. So it is going to be here. So the vastus medialis origin is going to be on the linea aspera. So the linea aspera is a line on the femur, specifically on the kind of posterior side of the femur. If we get out, let's see. So if we look at a femur, we can see on this posterior side, there are these two lines right here, this linea aspera. It's going to be attaching on the medial side of the linea aspera, but it's going to attach a little bit more proximally on that linea aspera, wrapping around and coming down and inserting onto the tibial tuberosity through the patellar ligament and through the patella. So origin going to be linea aspera. And we're going to insert onto the tibial tuberosity. And since we are not crossing the hip joint, we're just crossing the knee joint, we're in that anterior side, we are going to do knee extension. All right, so those are 1, 2, 3, 4. Your 4 muscles for today. Schedule time with me if you want to test for the second unit, and if you have any questions, let me know. Get to building.